Professional content outline, severe oral thrush in 2-month-old infants, etiology, impact, and expert management strategies. Introduction, the critical concern, the clinical problem, highlighting the prevalence of oral thrush, oral candidiasis in young infants, especially at the 2-month mark, a phase characterized by rapid development and an immature immune system. Severity. Focus, addressing the alarming symptoms, persistent crying, colic-like, severe sleep disruption, sleepless nights, and feeding refusal, and their profound impact on the infant's physical growth and neurological development. Article objective: to provide an evidence-based, expert-level perspective on the pathogenesis, clinical manifestations, and comprehensive treatment protocols from pediatric and oral health specialists. Scientific basis and pathogenesis, etiology and mechanism, definitions and differentials. Defining oral thrush due to Candida albicans, differentiating from milk curds, Epstein pearls, and aphthous stomatitis, less common in this age group. Mechanism of Candida albicans, infection in 2-month-olds, immune immaturity. The role of the nascent mucosal immune system, low SIGA levels, and lack of balanced oral microbiome. Primary transmission routes, vaginal delivery exposure, maternal nipple colonization, nipple thrush, and inadequate sterilization of feeding equipment, bottles, pacifiers. The pain cry feed cycle and sleep disruption, pain mechanism. The fungus causes epithelial inflammation and ulceration. Sucking or feeding triggers. Odinophagia, painful swallowing. Physiological impact. Persistent pain elevates stress hormones, cortisol, severely disrupting the infant's natural sleep-wake cycle and promoting relentless fussiness, prolonged, inconsolable crying. Clinical manifestations and diagnostic protocols recognizing severe symptoms requiring immediate intervention, inconsolable crying, lasting more than 3 hours per day. Significant sleep disturbance, waking frequently or complete nocturnal sleeplessness due to discomfort. Feeding refusal intake, reduction, consuming less than 50% of typical volume, signaling risk of dehydration, weight stagnation, loss. Critical indicators of failure to thrive, extracutaneous spread, concurrent presence of diaper rash, Candida dermatitis, expert diagnostic procedure, oral examination, differentiating firm, non-wipeable thrush patches from milk residue, assessing the extent of inflammation, source identification, careful examination of maternal nipples if breastfeeding, and assessment of feeding equipment hygiene. Laboratory testing, if necessary. KOH microscopy or culture to confirm Candida species and rule out secondary bacterial infection, BARV. Comprehensive management strategies, treatment and prevention. Pharmacological intervention, standard protocol. Topical antifungals, first line, nystatin oral suspension. Detailed instructions on dosage, administration technique, painting or swirling in the mouth after feeding, not just swallowing, and duration, 7-14 days. Second-line systemic agents, strictly controlled. Discussion of miconazole gel with critical warnings regarding dosage and choking hazard in infants, or fluconazole for widespread refractory cases. Pain management and comfort measures, crucial for sleep. Analgesia safety. Safe use of acetaminophen paracetamol, strictly dose-controlled by pediatrician, to facilitate feeding and sleep. Critical warning. Absolute contraindication of topical anesthetics, e.g. lidocaine gel, in infants due to high risk of systemic toxicity. Feeding modification, offering smaller, more frequent feeds, utilizing softer nipples to minimize painful friction. Preventing cross-contamination and recurrence maternal treatment. The mother must be examined and treated simultaneously, ERG. Topical antifungal creams, to break the cycle of infection transfer. Sterilization. Rigorous protocol for sterilizing all items that enter the baby's mouth, bottles, teats, dummies, using heat or steam sterilizers after every use. Oral hygiene. Gentle cleaning of the infant's mouth with sterile gauze and saline solution before medication application. Follow-up and expert recommendations criteria. For urgent reassessment, fever, text, temp. 31 circular textetsel. Concurrent with feeding refusal. Signs of severe dehydration, sunken fontanelle, dry mucus